Welcome back to Indiana News Desk. I'm Joe Wren. The healthcare exchanges went online this week in Indiana. An estimated 888,000 uninsured Hoosiers could use the marketplace to apply for insurance, and more than half of those would likely be eligible for some type of financial assistance. The pressure is on to get people to sign up, but as Sarah Whitmire reports, a number of obstacles, everything from technical delays with the website to political clashes, are standing in the way.
Jonathan Prather is a lot like most Americans when it comes to what he knows about the Affordable Care Act.
I don't know that much. I know that I'm applicable to, I know I have to sign up or something, don't I?
Yes, all uninsured Americans have to be covered by 2014 or they'll be fined.
Do you know what the penalty is?
The fine is $95 a year for adults or 1% of their income, whichever's greater. It increases each year. Of course, if you're insured, those fines don't matter. So let's back up. How do you get insured? The healthcare marketplaces that went online this week are really meant for people who don't have employment-sponsored coverage. They can get online, shop around, and purchase insurance at a reduced rate from one of the 4 providers on Indiana's exchange. About 888,000 people are eligible in Indiana. Folks like Prather. He's self-employed. For 2.5 years, he's run this skate shop in Bloomington.
I have 3 pairs.
Whether the exchanges work depend on whether people like him sign up. And a recent Kaiser Health poll showed only 12% of the uninsured knew the exchanges were going online Monday.
To me, it's kind of been surrounded by mystery because you haven't heard too much about it, just like bits and snippets from friends or neighbors or whatever.
It's scary. I think it's not terribly surprising, to be honest. I mean, healthcare can be confusing. The ACA has obviously been the object of a lot of political debate, and that's not going to end anytime soon.
As the vice president of Indiana's Hospital Association, Brian Tabor wants the exchanges to work. At the association's annual conference this week in Carmel, he and his colleagues were spending a lot of time talking about their role in getting people signed up.
The reality is financially there's a lot riding on this for hospitals.
One of the things the Affordable Care Act did was reduce payments to providers, hospitals being the largest group. In Indiana, it's about $4 billion over 10 years.
What we have is funding that would normally flow to hospitals through the Medicare system is now kind of at risk, and it's dependent upon people signing up for insurance. So we have a lot riding on getting people enrolled as soon as possible.
Hospitals are playing a key role in signing up the uninsured. Many have trained navigators, or people who can provide counseling sessions and enroll people in the insurance programs. At libraries across the state, staff members have been preparing for months for the exchanges to go live.
Every time the government or state government comes up with some sort of a new plan that is online, we anticipate that people are going to need help figuring out how to navigate these things.
And community members are preparing to distribute flyers and host informational healthcare fairs.
If you have any questions during the presentation, please feel free to ask me. If you ask somebody what they know about the Affordable Care Act or Obamacare, it's all about, kind of the political scorekeeping. It's not about the program or how it will help people or how it would be useful to them. And so, of course, the uninsured are very confused and uninformed about it.
On college campuses, volunteers are being deployed to get young people signed up. Particular attention is being paid to this age group, which has been termed the young invincibles, because they don't have health conditions and they're not worried about getting signed up.
In the long run, it's probably not sustainable if only the sickest Americans sign up for the marketplace.
Back at his skate shop, that argument seems to be the thing that touches Prather the most.
I definitely think I think healthcare should be for everyone, and so I think if me being able to pay a little bit and get insurance, and that also making it possible for other people to do that as well, I would be into that for sure. Yeah.
Sarah Whitmire joins us here in the studio for more to continue with Prather. If he were to get insurance, how much would he have to cost?
So it's a really hard question to kind of answer because there are so many different factors. We have to know some things about Prather. So we know he lives in Bloomington. We know he's 31 years old. You have to know whether someone's single, married. So we know he's single. We know he doesn't have any kids. You have to know the income. So I'm projecting $30,000. And then also, just for the sake of this, I'll presume that he doesn't smoke. So based on all of those things, he would qualify for a subsidy of about $1,100 a year. So if he were to sign up for the bronze plan, which is the lowest level plan, then his out-of-pocket expenses each month would be about $138 roughly. But the bronze plan is the lowest level plan you can get under the Affordable Care Act. It's the minimum that you're required to get, and it goes up from there, of course.
What kind of coverage would he get with that lowest level bronze?
Well, okay, so regardless of the plan, there are four. There's bronze, silver, gold, and platinum. Each plan offers the same benefit, things like ambulance service, prescriptions, dentist, prenatal care. Anything that you would think of when you think medical expenses is pretty much covered, but what varies is how much you pay. So if you get in at that bronze level, you're going to have a lower premium that you pay each month, but then say Prather needs to go to the doctor, which he's a skateboarder, it probably happens a lot. If he needs to go to the doctor, he's going to have to pay more when he goes to the doctor.
And so we did check that the online is back up and going. I know it wasn't earlier this week, so people can sign up, and they have through March.
They have through the end of March to sign up.
Okay, thank you very much, Sarah.